First of all, I would to recall the importance to make diagnosis in public veterinary laboratories, because this can assure the data flow to the EFSA annual zoonosis report. Secondly, the systematic control on abortion in ruminants is pivotal to assure the diagnosis and the knowledge of the infection. We have many diagnostic techniques. The first one is the direct diagnosis by PCR on bulk tank milk. This is very useful and at low cost if we need to be rapid and to know what is the prevalence of the infection in herds. Secondly, there is another kind of diagnosis that is the direct detection by PCR or real-time PCR on abortion product, so placenta or fetuses, aborted fetuses, and also vaginal swab taken as soon as possible after the event of abortion or parturition. We can also afford on quantitative PCR that can give us more information about the amount of infection and can leave us to know more about the potential of chronic shedders and high shedder animals. The serology can be of great help when the diagnosis becomes more difficult, such as in cows, because the symptoms are not so clear. We have less abortion, but a lot of infertility or subfertility problems. And serology in these cases can be very helpful. The epidemiology of Q fever is different for each animal species. For example, the pattern of shedding is different because, for example, in cows or goats, the shedding by milk is more important and can last for a long time, even for further lactation. In sheep, the shedding is more fecal, and in this case is more dangerous about the zoonotic risk by aerosol for humans. Secondly, we saw by genotyping techniques that strains are generally different among species. There are strains typical for goats, for ewes, for sheep, and for cows. Also, the clinical form can be some very different because generally at the first time of an outbreak in small ruminants, the clinical signs are very important. We can have 100% of abortion. In cows, the symptoms are less severe but more subtle and more difficult to diagnose.